Family Health. We have Clinic Manager Tracy VanBuskirk and Support Services Manager Nate Nimtz. Welcome back to the show.
Yes,
Thank
glad
you.
to be back.
Yeah, happy National Health Center Week.
Yes.
Yeah, this is a big week for us.
Yeah, so what is National Health Center Week?
So it's really a celebration of the work that all health centers do, but at the Center for Family Health that we do year round. So of course we provide care to patients regardless of their ability to pay, their insurance status. As a federally qualified health center, we have medical, dental, behavioral health, all those things. And we're actually here today to talk a little bit about WIN.
WIN.
Yes, WIN and centering, which are just an example of how we go above and beyond for our patients.
WIN, you ought to look online for some buttons from the Gerald Ford administration, because he had buttons made that said WIN.
Oh yeah?
And it was for whip inflation now.
Well, our WIN stands
stand
for
yours?
Yeah.
Women Inspired
Okay.
Neighborhoods.
All right. Yeah, I like yours better.
Us too. Us too.
So what is this Women Inspired Neighborhoods? What's that all about?
Well, our WIN, our centering program at the center, basically it's a group of pregnant patients that are due all about the same time, and they come and do their prenatal care in this model, which is a group model, which it helps with a lot of different things based on data, which we were trying to get all the data around, but it provides their medical care, of course, education, they have peer support, and they have community support. And a lot of these moms, when they come in and they spend all these weeks together while they're pregnant, they actually build these lifelong relationships with these other women that they didn't even know before. And it makes it very meaningful for our pregnant patients when
So
they're here.
you'll match them up? They don't have to go look for other pregnant women with the same due date?
No.
We of course match them up, and it's just another option for prenatal care, really. Our traditional care really involves, your traditional prenatal care is really those short one-on-one visits. Centering is really, it's more robust, right? So instead of those short visits, patients are getting like 2 hours with a provider. And moms really get to participate in their care. They take their own blood pressure. They're doing goal setting. They're all that stuff, and they get little booklets that they keep track of all that in. And it's facilitated by a community health worker as well as the provider, and really encourages that open discussion, learning from others, all of those things, and really creates that supportive environment that's really hard to get in short visits.
Mm-hmm. And we also are able to have our pediatricians come in and speak with the groups, so they can meet pediatricians. We can have our RNs come and talk about lactation. So they do get much more education and what we have available resources.
Is this geared to first-time moms or anyone?
Everybody.
Everyone.
Actually, when we're thinking about a good mix, right? It's good to have first-time moms, but then it's really good to have moms who've had 5 pregnancies before, right? Because they're the experts at that point, right? Because it's all about that shared learning. So.
And there's probably a side benefit that there's some peer pressure that they're going to make sure that they do all the healthy things.
That accountability piece,
Yeah.
right? Absolutely, yeah, for
It's
sure.
like having a workout buddy.
Yeah,
Exactly.
no, for sure,
Yeah,
for sure.
Exactly.
And that is available. It's just part of the services. And they meet. How often do they get together as a group?
Well, there's 10 total sessions, and they're scheduled in advance, so in advance through all of your pregnancy when
It's
you're
one of the big perks.
Yeah.
You know exactly when your
Yeah.
appointments are at the beginning of your pregnancy.
The first session is usually between 12 and 16 weeks, and the last one is between 36 and 40 weeks, and then we do a postpartum reunion after the babies all arrive. So that's usually pretty fun to get to show off their newborns.
They bring the babies.
Right, but for the CHW piece, this is
Yeah.
a super added benefit that we're able to do.
So as part of the WIN program, the CHWs they also support the moms individually. So in addition to group, our community health workers also do home visits. They do a total of 7. So they do 3 during the prenatal period, and then they do 1 postpartum, and then 3 additional visits within the baby's first year of life. And they can help with various different social, what we call social drivers of health, so transportation, housing, all those things. And it's really that full circle of care, because we know it's a really big focus with those social drivers of health, because we know in order for people to be successful, right, you have to be set up and have all those things. So
And we're already seeing, we're going to see improved health outcomes.
absolutely.
And you've already had your first
We
group?
had two that
Oh,
have
two.
graduated, two cohorts that have graduated successfully. So I don't know that we've had have we had the postpartum?
We have
meeting?
not yet, no.
Yeah,
We're
we-
working on that still, but, and we are working on collecting our data too. But nationally, there is some strong data on improved health birth outcomes.
I think we have a picture of the first group.
Oh yeah, we have a variety of different pictures with folks from our groups. Yeah, so
One of
lots
the
of fun things in our centering room. We have a dedicated room and a dedicated space. But some of the data nationally, 37% fewer NICU admissions, 58% reduction in preterm births, and 63% fewer low birth weight babies.
and moms are having a good time doing it.
Yeah, they do have a
Yeah.
good time.
Yeah.
They'll eventually be at each other's kids' high school graduations.
Could be.
Yeah.
That would be great.
Yeah, for sure.
All right, the week, every day, something different happening. What's today at Center for Family Health?
Today, our focus is population, specific population health, and we are focusing on WIN and focusing on our pregnant patients.
patients.
Yesterday, we were at, it was like resources, and we were at the interfaith shelter, actually.
Oh, nice.
And we took some blood pressure.
Yeah.
So yeah.
Is there an employee day where the center gives free food to the employees or anything like that?
Every day is an employee day at the center. No, the center did provide us with a lunch, and they do a lot to appreciate their staff there. It's a very excellent place to work, and
Absolutely.
they definitely appreciate us all the time. But yes, we did get free lunch.
Well, I appreciate you, and I appreciate what the Center for Family Health does in our community.
Thank you.
34 years.
Yes.
Yes.
Awesome. Thanks for coming over today.
Thank you for having us, and
Thank
letting us talk
you.
about one of our favorite programs.
Yes.
Yeah, it's pretty cool. I never knew about some moms-to-be. There you go, another great resource. Thanks to Tracy VanBuskirk and Nate Nimtz from the Center for Family Health. We'll check in with the folks from Lumen Christi as they're getting ready for back to school, coming up next.